So here we have it again, another outbreak, but this is in Michigan and it's hepatitis A. So they say it's worse in the US. So they are offering what people need to know about this. And chances are, if it's in Michigan, it'll reach other cities and other towns. And so I'm noticing there's a lot of outbreaks. And so if you hadn't really been paying attention, there are a lot of outbreaks. There's, those three patients that escaped from the treatment center that had Ebola, and they're worried that thousands of people have been exposed to that. There's this excreting that people normally do, and all of your, you know, it's disgusting, but I'm going to say it, like people who have been on drugs, or even if you're not a person that's on drugs, y- everything that people consume and excrete, it goes into the toilet, and then it goes into this, goes out to the ocean, and then it also goes into this filtration system, but a lot of it doesn't get filtered out. And so I did, trying to recall an article that I did that was on a type of a shellfish that is called mussel fish, and it has the opioid traces in there. And so there's a lot of things that are happening. I don't think people are really, I guess right now we're in the affecting us. And if enough of this happens, it could pose a problem. Um, so this article is, I don't know why it's loading, but I don't need to see any videos or anything like that. But it talks about hepatitis A. It has some quick facts. Learn all about hepatitis A in the 5 facts. So Christopher Laramie goes out to lunch most days, often with coworkers from the General Motors Tech Center in Warren. So the father of three said that he ate in March at the Buffalo Wild Wings, and that's a popular restaurant out here, Buffalo Wild Wings. It's actually spread to a lot of different places. It's a chain of restaurants. So across the Mound Road from his office, he went to this restaurant. And so it's the same restaurant where a food worker was later found to have hepatitis. If a person has hepatitis, you don't know who all those workers are in these restaurants who look like, they don't really, I don't want to sound mean, but I don't know how else to say it. But there's some people that are in the back cooking the food, and they look like they come from somewhere else other than the US of A. And um, then there's just regular people that are here, and you don't know what their health is. And so there's so many different people from different walks of life, and they're preparing your food. You don't know what their health status is. And so what he's getting at, he's saying that he went to this restaurant, and there was a food worker that actually had hepatitis A. So Lorene is one of the 837 people sickened with the virus in Michigan since August of 2016. So it has killed, and this is pretty serious, it's killed 27 in the state, which remains in the throes of the biggest hepatitis outbreak in the country. So as of May the 23rd, the hardest hit was Macomb County with 220 cases of hepatitis A, the city of Detroit with 170, Wayne County with 144, Oakland It can be spread through food, water, and contaminated by the feces of infected persons. Through close and this is, let me stop for a moment. This is why I said that I really am not feeling the relationship thing anymore. You know, people, they want to hook up, they get on these chat lines. You don't know who you're hooking up with. And sometimes, here's the sad part of it, some of these people may not even know they have this. They may have something, a sickness, and they don't even know they have it. And so who can you fault? If they don't know they even have it. There are some people who do know they are sick with something, but they're afraid to get checked out to find out what it is that they have. And so this is why I guess because when you're younger, let me break it down. When you're younger, you don't have the fears because you hadn't really experienced life like a person who's lived a little longer than you and had experiences and saw things happen to people, and actually something you might have experienced on your own, or you saw somebody else's experience, and it just, it traumatized you to the point to where you say, you know what, I'm not doing that anymore, or whatever I used to do, I'm not going to do anymore. And you're going to see that if you live long enough, younger people, that if you have enough bad experiences, because you will, or if you see others having bad experiences, it doesn't necessarily have to be you. You will learn from that. The best teacher is experience. And a lot of times that's what it takes, because your parents telling you, and some older person just telling you, they're telling you and informing you and suggesting to you, but it's not the same as actually going through an episode of having a sickness, or either seeing your friends die to a sickness. You have to experience that. Some people are like that. They don't believe it until it happens to them, or they actually see someone that is close to them, lives be taken away from something like that. And so I'm afraid that this generation has to actually go through an experience, just like the generation, where people died of AIDS. There wasn't any medicines. You just died. And when you see enough death or enough sickness, you'll learn that, hey, I ain't doing whatever I was doing before. I'm not doing it. I'm not taking these type of risks. And so a lot of times people live in this world, and they feel they own the world, and they feel like the world owes them, and that they're going to go out and they're going to do whatever they want. They're going to live that life, and until they have a few experiences and they say, oh, okay, I'll try it again. And then if they have some real hardcore experiences, they learn that it's time to get my shit together. I'm not doing this anymore. And sometimes that's what it takes. So young people don't get it. They laugh, they joke, they make fun of other people's experience because they didn't go through it, or they're not going through anything at the present time. But wait, it's coming. It's coming. And when it does, it'll either make you where you learn the lesson, or you'll be broken from it. And you'll learn in a way which you don't want to learn. And then it'll be too late. So I'm just really being honest. So things like this, hepatitis, is nothing to shake a stick at and say, oh, that's not that serious. There's all these people that have died from this. And so I've been seeing a lot of outbreaks happening a lot lately. And these are the things that people fail to believe because it doesn't happen in their city, in their town, or to somebody they know. It's not registering to everyone just yet. But guys, it's really serious. Anybody could get this. It's not, It doesn't say, oh, we're going to skip over the white people, or we're going to skip over the black people, we're going to skip over the Latin people, or we're going to skip over the men or the women. No, all of us. We're going to skip over the Asians. No, or who or wherever you come from, whatever your nationality or race or gender, these viruses and diseases can get you. It doesn't matter what you look like and how clean some people think they are. It may not be you that is unclean. It could be who you're with. Or maybe as simple as this guy going to a restaurant and somebody happens to have it, and now you get it. So the virus is highly contagious. It says it can be spread through food, water, contaminated by feces of an infected person, through close contact, and even sex with a person who has hepatitis A, or by touching surfaces that are contaminated by the virus and then touching your mouth. It can cause liver inflammation and liver failure in extreme cases, and it can be prevented through vaccination and hand washing. So, for those people who said, I don't believe in vaccinations, if you get something like this, oh, you're going to believe in a vaccination because you don't want to die. And Jesus ain't going to save you from that. So all these people going around talking about what they believe in, if you get this, all of a sudden you want them vaccinations because you are not going to go on faith alone. So it's just common sense. So the outbreak has led to alerts from county health departments about several restaurants in Metro Detroit, whereas 35 workers were found to have the virus. Now, we got to ask ourselves, how in the hell is 35 workers working in restaurants with hepatitis A? Shouldn't they be screening these people who are cooks so that they don't give this? Because there's so many people that frequent restaurants. And so unsuspectingly, you could contract this virus from someone who they did not screen properly health-wise to be, how would you say, sanitary enough to work in conditions where they're handling people's food. So this is pretty serious, very serious, because you're not even knowing, you're, an innocent, pretty much victim of this, not even knowing that those cooks in the back, maybe one or two or three out of five of them could have this virus. So it said they found that to have the virus and who may have spread it unknowingly to diners, people in restaurants that go and eat and don't even know that the people in the back preparing their food have the virus. So the virus is contagious weeks before a person begins to exhibit their symptoms, which makes it extremely challenging for the public health officials to manage. So the Wayne County Health Department and the City of Detroit Health Department now recommended all restaurant employees and food handlers get vaccinated or vaccines. So Oakland, they should have done that long ago. Don't just now do it. This is now how many people have got it and don't even know they have it. Anyway, Oakland County's Health Division also urges restaurant employees to consider vaccination. Last month, the state of Indiana's Department of Health issued a travel alert warning. What is called Hausers is planning to visit Michigan to get vaccinated before they come. So through Lorene, 46 years of age, of Grosse Pointe Park, can't be certain he contracted the virus at Buffalo Wild Wings and not at another restaurant or in some other way. That's how he suspects he was sickened. So he knows it's at a restaurant, but because, if everybody likes saying this is a holiday weekend and what are people going to do? Probably go out to eat, go to a movie, go out to eat and go have fun, be with their family. And you don't even know this stuff. You just want to have a normal life. And here you are. You just, you and your family now got hepatitis A. So I could take a rough guess, he said. If I look back now, there was fever, stomach pain, shortness of breath. Probably the biggest thing was just, I felt like eating very little, so he had a loss of appetite. Those symptoms led to him. And so this is Christopher Lorraine to my left. He's seems like a nice fellow. Um, so it says that the symptoms led him to the emergency room at Beaumont Hospital in Grosse Pointe, where he was hospitalized for nearly about a week. And so that's really sad. And see, he looks like he's a traveling kind of guy. And so he's 46 years old. And he said he came down with hepatitis A around March. And so the reason I eventually went to the ER was because it was so persistent, he said, that he had acute hepatitis, so that his liver enzymes were way out of whack. The strain of hepatitis A that has spread through the Metro Detroit the last 2 years has a higher rate of hospitalization than past outbreaks, said Jay Felder, an epidemiologist who is a section manager for surveillance and infectious disease. And so the epidemiology with the Michigan Department of Health and Human Services, of the 837 people who have contracted the virus since August 2016, 80% or 671 have been hospitalized. 671 people hospitalized and 3.2% have died. So that's a far rate of hospitalization and death than normally seen with the hepatitis A virus, said Dr. Nicholas Gilpin, Chief Medical Officer of Beaumont Hospital, Grosse Pointe, and Medical Director of Infection Control and Epidemiology. For the average person, hepatitis A is more a nuisance, he said, of an ordinary outbreak. There's a very, very slim chance that hepatitis A infection would lead to serious complications. About 1% of the cases will go on to the liver failure. And that's pretty serious, which means you would require a transplant. And in a majority of cases, you feel sick for a period of time and then you get better. But since August 2016, people who have been sickened in Michigan and in the outbreaks of San Diego and Utah haven't fared as well, Felder said. So this is Dr. Nicholas Gilpin of Beaumont Hospital, Grosse Pointe, to my left, who is also talking about this virus. In all three of those jurisdictions which have been mostly heavily impacted by the ongoing hepatitis outbreaks, the hospitalization rates have all been very high, Felder said. So in our case, it's up around 80%. So in those other locations, I believe it's been up between 70 to 80%. So we're seeing something in Michigan that has been very similar to what we're seeing in other places around the country. Something is different. Yes, it is. And we're trying to figure it out. What is it? It's going to take a little while. So it's pretty serious. Felder said that U.S. Center of Disease Control and Prevention is investigating, but what he noticed is a spate of infections is that it has most impacted an older population with other illnesses that make them more vulnerable to more complications of hepatitis A. Among those who have died in Michigan as part of the outbreak, most of them are 50 and older because they already have pre-existing illnesses, Felder said. I'm adding that in there. So they have other illnesses, so they're more susceptible of death. So they have died of liver failure, septic shock, or other organ failure. So generally, it is been people who are more sick or people who have less access to health care, which could be homeless populations, people who are poor and don't have any health insurance, and also maybe young people who are, living a risky life and they're sleeping around with different people. You could be sleeping with someone with hepatitis A. Also people who are older and they might have pre-existing illnesses, I would gather. So, we've seen a homeless component. Now, I've said this before I even started reading, a homeless component to this. We're seeing a driven by a substance use disorder risk. And, folks that are harder to reach might not seek health care, of course, quite as much. And so we think those really are risk factors that play into this. And so there's some people that don't go to the doctor at all. They don't go to the doctor unless they're all nearly on their deathbed. There are some people that operate like there's some people that believe the only people that should go to the doctor are women because women have the babies. Believe it or not, there's some people think that. Oh, men don't need to go to the doctor. Men are men. They can be a man. They don't need to go to the doctor. So you ladies sleeping around, you will see what you're getting yourself into very soon, unfortunately. And you men who think you don't need to go to the doctor, you will see what you're going to get yourself into. It's coming because of the way you live. If you live with those beliefs, thinking that you don't need to get checked out and you don't need to be safe and take care of yourself, then you'll see what will happen. So, people who use illegal drugs account for about half of the outbreak related cases because they're sharing needles. And so, that's contaminated needles of people who probably have not only HIV, but hepatitis A. And so, when we see cases moving to new areas, it's often in populations, he said. They seem to be people who are driving it to new areas and are kind of continuing to propagate this outbreak at the point in time. So people travel, they move around, or they go around from city to city, town to town. And then if they are sick with something, they're traveling their disease, their virus around to other places. And so it's a very hard group to reach. And it's a very hard group to get public health messaging to, exactly, because some people hear this stuff, they see it, like, it ain't happening to me. I'm clean, I take a bath. Somebody thinks like that out there, believe it or not. I take a bath, I put on cologne, I put on perfume, I get my nails and hair done. I'm not sick, I'm clean, I fix my face, I go work out at the gym, or whatever. So, believe it or not, people think that's all they need to do and they're safe. There's a lot of trust issues with government entities in general. So that's the another reason. Some people don't trust some doctors. I mean, look at some of the stuff that's been going on with some of these doctors. You know, some people are afraid. They may want to get checked, but they may have fears about doctors. And then they may have fears about vaccinations. What's in those vaccinations? Are you actually giving me something to keep me from getting sick? Or are you giving me something that's going to get me more sick? So those are some good questions and some reasons why maybe people feel trapped, in what they should do in terms of their health. And there's a lot of outreach going on to the local public health to people they do trust in the community. So still, the State Department of Health and Human Services does not recommend that everyone in Michigan get a vaccine. Rather, it suggests continued routine vaccinations for all children starting at the age of 1 and for adults who are in this category. If you're homeless, and if you're incarcerated, if you non-injection of illegal drugs, work with high-risk people listed above in the homeless and incarcerated populations, have contracted or have contact with care or live with someone that has hepatitis A or have sex with someone who has hepatitis A, which in that case, people don't tell you their sexual history, guys, women who don't share their sexual history. They just hop in the bed with whomever and think it's all to the good. There are men who have sex with men, yes, and have sex with someone who may be infected and travel to countries with high or medium rates of hepatitis A or have chronic liver disease such as cirrhosis, hepatitis B, and hepatitis C. You already have pre-existing illness. so you're more susceptible. Or you have clotting factor disorder. And so the vaccination also is recommended for anyone who may have been exposed to a person with the virus, so long as people who have been exposed to hepatitis A are vaccinated within 14 days and often given a boost of immune globulin. The risk of contracting is greatly reduced then from that point. So I think that people need to evaluate their risk, Felder said. So this is something that I can't make a blanket statement that everyone should be vaccinated for hepatitis A. So I think that they should evaluate their personal risk factors. So those are the personal risk factors are these things here. So since we've seen a growing number of homeless people, homeless people, they go in public places like fast food restaurants, public bathrooms. And what do regular people who aren't homeless do? Sometimes they stop at the fast food restaurant and get a drink of coffee. Sometimes you got to use the bathroom. So you might be exposed to something and not even know it. So those are other ways. And so this is something that I can't make a blanket statement, he says. So he goes on to say that MDHHS spokeswoman Lynn Sufton said that Indian Health Advisory recommending its residents to get vaccinated for the hepatitis A before traveling to Michigan is overstated. The recommendation doesn't match what we've worked on with the CDC or the CDC recommendations, she said. So those risk populations or high risk populations definitely should consider getting vaccinated. But there is not any kind of states for hepatitis A. So think about it. You're on and you got all these people. Some people are going to yawn, cough, whatever. You could be sitting next to somebody, they could be infected. This is how easy this can spread. I mean, it's very scary. Just the thought of this, you don't know, and they say they know, but you never know. You don't know if somebody's wiping their nose or they cough in their hand, put their hand on the armrest, and now did scenarios. But now the outbreak in Michigan has showed some signs of slowing in the first part of 2018. So however, health officials are bracing for another upward swing of this in case in the summer months. And summer is fastly approaching. So this is why this is coming out. So typically in the winter and the spring, it tends to be lower but we see a little more hepatitis A in the summer. We are still seeing cases at a rate that are very much exceeding what we would typically expect in Michigan at the time of the year. So we're seeing about 6 cases a week. In Michigan, we typically see 60 cases a year. So at this rate, in 10 weeks, we're seeing our yearly expected total of hepatitis A. Through adults, typically it gets 2 doses of vaccine spaced 6 months apart, and the CDC recommends just 1 dose right now, as it has a limited supply of vaccine. A limited supply of vaccine. Now, I remember, like when they had the flu outbreak, they had a really scarce flu vaccine, and so just think of what that would cause if they don't even have a vaccine for these viruses, or they didn't have any, large supply and quantity, and they ran out. And then there will be a lot of more deaths or fatalities, unfortunately. So okay, so it says right now we're in a constrained vaccine supply. The current record trying to get 1 dose in as many people as we can, because one by preventing hepatitis A infections, Felder said. So here in Michigan, to be dealing with this outbreak in the month still, and I know there's currently outbreaks in Indiana, Kentucky, Ohio, West Virginia, Missouri is starting to see an increase of the cases. Given what I know about the regional activity, I think that CDC is going in a constraint for a while for the vaccine. Handlers in general fall into a much lower priority risk group across the state. MDHHS focus for vaccine or vaccination substance. However, she knows areas in high, such as Oakland, Macomb, and Wayne counties, the city of Detroit, our recommendations are slightly different, and outreach handlers is appropriate. Felder said that while hepatitis A is a public health risk to be taken very seriously, when you look at the epidemiology of this outbreak over a course of almost a year and a half now, we've identified food handlers as there. Very few of those have been in a position. I'd say maybe half of those have been in a position where, if required public notification, the post-exposure prophylactics response. So I anything that is a when they're eating out, then they would be about anything else. Of course, I work in public health, and I have a pretty good idea that what happens behind the scenes is more about neurovirus or E. coli. So those are the things that people would worry. She said that they should worry about, but that's just disgusting. So for anybody that, can you imagine that has to do with hand washing? So, it makes you kind of think that, your food in these restaurants, if he goes to the bathroom and doesn't wash his hands and he prepares your food, that all of what he's used the bathroom, he or she or whatever, and it's usually, I see a lot of chefs in the back, guys, that if they're not clean, and it can make you very sick, very ill, or you can get food poison. So many other things before I would worry about hepatitis A from a restaurant situation. So we see a lot of borne transmission of communicable disease and other viruses and bacteria and have kind of things scared of that we don't even know about, and you don't know exactly what I said. So it goes into and what is it's contagious liver inflammation. It can be very deadly. It spreads to people that come in contact with feces of people. The virus is by eating contaminated. You can get it by eating contaminated food or contaminated water, or having a person is infected with an infected person. Think about it, just by living with an infected person, because you have more exposure to that person that has that virus, and you're sharing the bathroom, sharing probably utensils and things like that. So people can survive, which makes it so easy to pass. So the symptoms, not all people have with hepatitis A exhibit the same symptoms or exhibit symptoms, but most people who experience one or more of the symptoms, this is what it is: nausea, vomiting, belly pain, feeling tired, fever, loss of appetite, yellow of the skin, and dark urine, feces, joint pains. The hepatitis A. So children born after 1999 have routinely been vaccinated against hepatitis A. For adults, 2 doses of the vaccine spaced 6 months apart will provide lifelong protection from the virus. Health officials are washing after using a bathroom before. Do not share towels, toothbrushes, food, cigarettes, and I've seen a lot of guys who share cigarettes with one another. Seeing that. Eat 10 people, 9 other people. Who shares a toothbrush? Somebody out there does that nasty stuff, but sharing towels now that you may not even know they use to go and use the towel behind them. And you may not even know that they use that towel. So that's something you didn't even know. And eating utensils, like I had said earlier on before they even started talking about it, is you're thinking, oh, okay, I'm gonna, I'm gonna eat this. Utensils are not clean. That you can spread it. So if you've been exposed to someone with the virus or vaccine within 14 days of exposure, potential with the immune globulin injection has been shown to be effective in preventing the infection. So how to learn more is through the Michigan Department of Human Services has updated the information about the outbreak on its website. So there's a website where you can look it up. So where to get vaccinated. So there's a number of places you can get vaccinated. And so they have this listed here. And so I'm just panning through it. It gives the times. So you'd have to look up in your local city, your area, where they do vaccinations for Wayne County, Detroit, Macomb County, all these places, Southeast Service Center, the Southwest Central Health Service Center. There are places that have addresses where you can get vaccinated. So that's in the Detroit Health Department, along the Wayne, Oakland, and Macomb County health departments are offering hepatitis vaccines. They cost from anywhere from $25 to $65. They offer vaccines at a reduced cost or free insurance. So about that, free to people without insurance or who don't have the ability to pay. This virus is serious enough to offer the vaccines to protect people from this deadly virus, even if you have no ability to pay. So those are important things that people should know, because that might be the driving factor as to why people won't get vaccinated too. It's not because they don't believe in it. It's because they feel that, oh, I'm going to have to pay for this, so why do it? Because I don't have money. Population, so they're probably going to be like, more apt to turn away and feel like, I'll sit this out and maybe it'll go away because I don't have the money to pay for it. And so this right here, I guess it was a video. I wasn't really looking at, but that's an unfortunate situation. So this comes out of the Detroit Free Press. And so Michigan hepatitis A outbreak is worse in the U.S. What you need to know that. And so it's an unfortunate situation, but I've noticed that there's been a lot of things that have come out lately, and now it just doesn't sit well with me. I did an article too about the EPA and, the administration or people who were involved. They didn't want cameras to go in there. So it's like a big secret. Like, what are they hiding? You'd want to know. But anyway, that's that, when they said infected water. So I guess it is a good idea to buy bottled water or water that you can get out of the store, and that, but people do that in the event of an emergency. Like when there's before natural disaster, they try to stock up on water. And so that's a smart thing to do. Kind of get yourself kind of prepared for these kind of crazy things that happen, especially what happened in, I believe, I don't know if it was Flint, one of those places where the water was really, really, it was contaminated, and the people, they couldn't even drink the water because the water was so bad. And that had to do with, I guess, their politicians. They were trying to skimp on the water, the treatment of water. And then I think the person that did that, he ended up getting in a lot of trouble, because what he did was there were traces of lead and a lot of other gunk in there, and people were getting like skin rashes and lesions, and they were getting sick and health issues. Their hair was falling out. It was awful. And so just by that, well, I know I must have freaked some people out, but it's just stuff you need to know. And I think some people, they just don't think about these things. They're too busy thinking about material items. that you can't take to the grave with you. And so I guess I'm an old soul. I have a way about me where I kind of think outside of the box and think ahead. Okay, this is good now, but what if? Anyway, with that being said, like, comment, subscribe. Thanks for listening. Be safe, y'all. Have a wonderful weekend. Until next, bye.